Hello, my name is Dr. Jocelyn Dore, and I'm one of the audiologists here at Advanced Specialty Care. One thing that we often hear from our new patients is, how long will it take me to get used to my new hearing aids? The short answer is between 30 and 45 days. The state of Connecticut actually requires that we give you at least 30 days with the hearing aids before you're stuck with them, before you have to keep them. Our policy is a 45-day trial period. And the reason that we give you that additional 2 weeks is because it can really take a month and a half to acclimate to the sound of the hearing aids and to get used to manipulating them. So we're going to be talking today about those two types of acclimation: the acclimation to the sound and the acclimation to the physical manipulation and day-to-day use of the hearing aids. So first, let's talk about acclimation to sound. Typically, when someone loses their hearing, they lose it very gradually, just over the course of years of your life. The nerve cells in your ears wear out and you accumulate more and more hearing loss. So your brain gradually gets used to less and less hearing. When you get hearing aids, all that sound comes back all at once, and it can be really overwhelming for a new user, especially for an older user whose brain isn't quite so plastic or malleable. So what the audiologist will usually do is set the hearing aids slightly lower than they're supposed to be so that the sound isn't quite so overwhelming. And then the patient will use the hearing aids for 2 weeks at that volume and then come back for a follow-up. And typically the audiologist will turn up the hearing aids a little bit at that first follow-up, so the patient can gradually get used to more and more volume. The only way to get used to the additional volume, though, is to actually put the hearing aids in your ears and to wear them consistently. So we really encourage patients to wear the hearing aids for between 12 and 18 hours a day, really during all waking hours, to acclimate to the hearing aids. And actually, every time we hook up the hearing aids to the programming computer, we can see how many hours a day the hearing aids have been worn. So if a patient remarks that they're having trouble getting used to their hearing aids, and then we notice that the hearing aids are only being worn 8 hours a day or 10 hours a day, we'll probably encourage that patient to try to stretch out their use throughout the whole day. Even if nobody's home with them, even if they're just sitting around reading the paper, the hearing aids should really be in the ears. This brings us to the other aspect of acclimation, which is getting used to the physical manipulation of hearing aids. When a patient first gets their initial set of hearing aids, it can be a little intimidating putting them in their ears. Patients tend to think that hearing aids are a little more delicate than they really are, so they're a little nervous about handling them. And then putting them into the ears can sort of feel awkward with me watching them, perhaps a spouse or an adult child who's come with them to the appointment. So we do spend time during the initial hearing aid fitting making sure the patient understands how to insert the hearing aids and change the batteries. But I really encourage my patients during that first 2-week period to every day lay out a towel on the kitchen table and practice putting in the hearing aids and taking them out, manipulating the batteries or manipulating the charger if they have a hearing aid charger, so that at that first follow-up, if there's an aspect of insertion or an aspect of physical manipulation that's just consistently problematic, then we can address it. But if you haven't given yourself an opportunity to practice, we don't really know where the problems lie and where there may just be areas that you're just not accustomed to manipulating the hearing aids yet. So if you practice in this way, both wearing the hearing aids consistently and physically manipulating them consistently over the first 2 weeks, that ensures that at that first follow-up, you can provide some really concrete feedback to the audiologist so that he or she can make meaningful adjustments to the hearing aids to continue you on that process of getting used to the hearing aids and making the best use of this new technology. So the acclimation process is really a give and take between the audiologist and the patient. We can only make adjustments Otherwise, we're sort of guessing what you need. A lot of it is based on your own listening environments, because your listening environments are unique to a different patient's, the acoustics of your house, the types of people that you talk to, what their voices are like. So it really does depend to some extent on your own experience. So we spent a lot of time talking about that. So in conclusion, at this practice, at Advanced Specialty Care, we really commit to guiding the patient through that acclimation process to make sure that we're really maximizing the type of benefit and making sure that the patient does the very best that they can with their new hearing instruments. Thank you.